Welcome to Reset, the podcast that changes the way you think about health. Because the body isn't broken, it's adapting. I'm Dr. Catie Harris, and today and every week we're going to explore the incredible biology that keeps us alive, why our bodies change over time, and how asking better questions can completely transform the way we think about health. So, if you've ever left a doctor's appointment feeling like you had more questions than answers, or if you've been told your labs are normal, but you know something just doesn't feel right, or if you've ever found yourself lying awake at night wondering, why didn't anybody just tell me this? Then you're in exactly the right place. So I want to start today's episode with a confession. For most of my career, I was asking the same questions everybody else was asking. What's the diagnosis? What's the treatment? What's the medication? What's the next guideline? And yes, those are important questions. So, and I'm incredibly grateful for modern medicine. So I've worked in healthcare for more than 25 years, and I've seen medicine do extraordinary things. I've seen lives saved in the emergency rooms and the operating rooms. I've worked with surgeons who seem to perform miracles. I've seen antibiotics turn life-threatening infections into routine illnesses. So absolutely modern medicine has transformed the world, there's no question. But over time, I started noticing something that we had become incredibly good at just naming diseases. In fact, we're exceptional at it. And everybody's got a disease that they want to name after themselves, right? We have Hashimoto's disease, Alzheimer's disease, and then we have type 2 diabetes, multiple sclerosis, metabolic syndrome, fibromyalgia, right? The list goes on and on. And with every disease or every diagnosis comes a protocol. You get this medication, and this is how we're taught in medical school and nursing school is here's a brief description of the diagnosis and then the pharmacological intervention, right? And then there's a specialist who specializes in that particular disease, and then you get a follow-up appointment and all that kind of good stuff. But there was one question that seemed to get lost somewhere along the way. And the question is simple. Why? Why did this happen? Not what do we call it, not how do we manage it, but why did this person's biology change in the first place? And the question became impossible for me to ignore. So one of the things I love most about medicine is that it does force you to stay curious. The day you stop asking questions is the day you stop growing as a clinician. And I realized I wasn't satisfied with simply identifying diseases anymore. So I wanted to understand the biology. I wanted to understand what the body was actually trying to accomplish. Because when you think about the human body, it's almost impossible not to be amazed. I mean, your heart beats over 100,000 times every single day. It's not like it can take the weekend off. You can't, give it a break for an hour, and you don't even have to think about it. You take around 20,000 breaths. Your immune system identifies millions of potential threats, and your liver performs hundreds of different chemical reactions every minute. Your brain processes more information than any computer ever built. Your skin is constantly repairing itself, and your bones remodel themselves. If you break your bones, they form back into place, which is amazing. Your gut replaces its lining, and while you're sleeping, your body still works constantly, quietly, faithfully, every second of the day. So the question that keeps coming back to me is that if the human body is capable of doing all of that, why do we all so often assume that when something goes wrong, it's because the body's confused or suddenly became stupid or doesn't know what to do? I mean, think about that. One day your body is intelligent enough to coordinate 44 trillion cells, and the next day it's just randomly making mistakes. I mean, that doesn't make any sense. So now don't misunderstand me. I'm not saying that disease doesn't exist, of course. I mean, of course it does. Cancer is real, heart disease is real, people suffer, people die, and I'm not minimizing that. But what I'm suggesting is something different. Maybe, just maybe, the body is doing exactly what the biology has always done. It's responding, it's adapting, and maybe the symptoms we experience aren't random acts of betrayal. They're clues. The body's trying to tell us something. And if that's true, then perhaps the most important question isn't what's wrong with me. Maybe the most important question is, what is my body responding to? Why is it responding? So the single shift in perspective changed everything about the way I practice medicine. And for example, I had a patient who came into my office several years ago, and she was terrified, right? Not anxious, not nervous, terrified. You could see it in her face before she even sat down. So she had recently undergone an upper endoscopy because for stomach issues, right? And the endoscopy is where they put that camera down your throat and they look at your stomach, and a few days later, you get the biopsy report back. And in her case, the diagnosis was gastric intestinal metaplasia. Now, unless you work in medicine or pathology, you probably don't know what that term means. And she didn't either. So she did what everybody else would do, and she Googled, right? Started searching. So within minutes, she was reading phrases like precancerous condition, increased risk of stomach cancer, requires surveillance, potential progression, those types of things. So by the time that she came to me, she wasn't thinking about improving her health. She was convinced she was dying, and what was she going to do? So when she sat down, the first thing she asked was, am I going to get cancer? Now, I could have immediately started talking about treatment options, and yes, you're on the path to cancer and all these kind of things. And you're going to need follow-up endoscopies and dietary changes, medication, supplements. And yes, she probably is going to need all those things, right? And all of those things matter. But instead, I asked her a completely different question. So I said, do you know what the word metaplasia actually means? And she looked at me and like everybody else in my office that would, if I asked that question too, she said, no. Because honestly, most people don't, and there's no reason you should know that word. But the word comes from Greek. Meta means change. Plasia refers to formation or growth. So metaplasia simply means a change in the type of cell that's present. It's a description, not an explanation. And that distinction is incredibly important because describing something isn't the same as understanding it. So if I tell you your house has smoking coming out of the roof, I've described the situation, but I haven't told you why there's smoke. Is dinner burning? Is there electrical fire? Did somebody start the fire? Is the chimney blocked? Is the neighbor having a barbecue? The observation is only the beginning of the investigation. Yet, so often in medicine, we stop at that observation. So I asked her another question, one that, in my opinion, doesn't get asked nearly enough. And the question is, why would the cell decide to change? So you have to think about that for a moment, because cells, they don't have emotions that we know of anyway. They're goal directed. They want to survive. So they don't wake up one morning and decide that they feel like becoming a different kind of cell. Just like you don't wake up as a plumber one morning and decide you're going to go to med school, that there's usually something that happens, right? A situation that occurs that you're responding to. Because biology doesn't work that way any more than you do. Cells respond to the environment they're living in, just like you respond to the environment you're living in. Cells respond to nutrients, hormones, inflammation, just like we would respond to, let's say, a war or famine or heat wave or something, right? The cells are responding to the stress, and their job is survival, just like your job is survival. And if the environment changes, the cells adapt, not because they're trying to hurt you, but they're trying to survive. So this conversation completely transformed the rest of her appointment. So instead of asking, how do we treat this? We started asking, well, what has your stomach been experiencing for years that have led to this adaptation? And suddenly we were having a completely different conversation. And that's where this reset was born, this reset method. So when the patient left my office that day, I couldn't stop thinking about our conversation. Not because of her diagnosis, it wasn't terribly original, right? But because of the question it forced me to ask. What if almost every chronic disease begins as an adaptation? Now, before you throw your phone across the room because you think I've completely lost my mind, let me explain. Because this idea isn't some new theory I came up with. It's actually one of the oldest principles in biology. Life adapts, right? Always. Think about every living thing on the planet. It's the basis of evolution, right? Trees, fish, birds, bacteria, viruses, plants. Every species has survived because it adapted to its environment. Not because the environment became easier, but because life changed. So here's the question. Why would we assume that human cells are any different? Why would we assume that trillions of cells inside your body are only the only living things on Earth that somehow don't adapt, right? They don't, they can't. Adaptation is what life does. So think about something simple. If you've ever have you ever developed a callus on your hand, right? Of course, maybe from lifting weights or working in the garden, playing a guitar, or using tools every day. Your skin doesn't suddenly become disease. It adapted because it sensed repeated stress. It recognized that the environment had changed and responded by becoming thicker and stronger. Now, is that callus normal? Yes, of course. Can it become excessive? Also, yes. And nobody would argue that the body made a mistake. The body solved a problem. Now, let's make it a little more interesting. What happens when you move the sea level to Denver or Peru or the mountains? Well, the oxygen level drops. Your body notices almost immediately. So within hours, it starts making changes. You breathe faster. Our heart rate increases. Over time, your kidneys release erythropoietin. Your bone marrow begins producing more red blood cells. So you literally change your blood to adapt to a different environment. So nobody calls that a disease. We call it acclimatization because we understand that biology is responding appropriately. So here's my question. If the body can adapt to altitude, why wouldn't it adapt to years of poor sleep or chronic inflammation or nutrient deficiencies or emotional stress or environmental toxins? Why do we stop believing in adaptation when the environment changes inside the body instead of outside of it? So I think one of the biggest problems in modern healthcare is that we've become really good at naming um, the adaptation without always asking what the adaptation is trying to accomplish. So let's use another example. So a fever. If your child develops a fever, what's the first thing many parents do? Well, they reach for acetaminophen or ibuprofen, and sometimes that's appropriate. And I'm not saying that fevers should not be treated, but why is the fever there in the first place? Did your brain accidentally turn the thermostat up? No, your immune system intentionally reset the body's temperature. And why? Because viruses and bacteria don't reproduce efficiently at high temperatures. Your body isn't malfunctioning, it's changing the environment. And that's fascinating when you stop to think about it. Your body is literally making life harder for the pathogen, and the fever is part of the strategy. Now, of course, very high fevers can become dangerous, especially in certain populations, and they need medical attention. The point isn't that all fevers should be left alone. The point is this. Before we ask how to lower the fever, it's worth asking why the fever developed in the first place. Because underneath understanding the purpose of a response often tells us something important about what's happening underneath. And the same thing happens with inflammation. Now, inflammation has become like a bad word. Everybody wants to lower their inflammation. You want an anti-inflammatory diet, an anti-inflammatory supplement, anti-inflammatory medications. But what would happen if you cut your finger while chopping vegetables? Would you want inflammation? Absolutely. Without inflammation, you wouldn't be able to recruit immune cells. You wouldn't remove damaged tissue. You wouldn't begin the healing process. Inflammation is not the enemy. Uncontrolled inflammation is. There's a huge difference. Inflammation is like firefighters responding to a house fire. When the fire is out, the firefighters should leave. The problem isn't that the firefighters exist. The problem is if they don't ever go home, right? Like they just camp out in your house now. Like that's going to become a problem. And that's where I think language matters. because words shape how we think. And when you hear phrases like your immune system attacked your body, or your body is failing, or your body's breaking down, it creates an image of the biology as the enemy. And I don't think that's accurate at all. I mean, can the immune system become dysregulated? Absolutely. Could it begin targeting tissues that shouldn't? Yes. But even then, the immune system isn't waking up one morning and saying, you know what, I think I'll attack the thyroid today. Something changed in the communication. Something altered the environment and some signal was misunderstood. Again, it's not an excuse, it's an explanation. And explanations are where the solutions begin. So, one of my favorite analogies is the smoke detector, right? Imagine you're sitting in your living room and suddenly the smoke detector starts screaming. Now you have two choices. You can take the battery out, or you can ask why there's smoke. If all you do is silence the alarm, then the house may continue burning, right? The alarm wasn't the problem, it was the messenger. Now, we want to be careful here because in medicine, sometimes we absolutely need to silence the alarm. If someone's having a severe asthma attack, we want to open the airways. If someone has dangerously high blood pressure, we want to lower it. And if you have uncontrolled seizures, obviously we want to stop those. So those interventions save lives. But once the emergency is over, we still have to ask why the alarm went off, because that's where long-term healing begins. And I think that's one of the biggest shifts in this reset method that it asks us to make. So you don't want to stop at the symptom. You want to listen to what it's trying to tell you. So I often tell my patients that symptoms are not conversations ending. They are conversations that are just beginning. So fatigue is a question, right? You can think of all of these things as a question. Weight gain is a question. It's a physiological response to something. Joint pain is a question. You have joint pain. Why do you have joint pain, right? High blood sugar is a question. High blood pressure is a question. So even abnormal laboratory results are questions. The biology is trying to tell us something. And the challenge is learning how to listen. And that's exactly what we're going to be doing together on this podcast. Because before we talk about peptides and before we talk about hormones and longevity or supplements, we have to learn a new language. And the language is biology. So once you understand that language, you never look at your health the same way.